In this video, I want to share with you a tip for medication administration during a pediatric arrest. And the two drugs we're talking about are epinephrine and amiodarone. Now, there's a ton of tricks and tips out there in EMS, but when it comes to medication administration, you must make absolutely sure that your concentrations are correct. So for this trick to work, we're going to use epinephrine, 1 milligram, 1 to 10,000, standard epinephrine. The amiodarone we're going to use is 150 milligrams in 3 mLs. These are pretty standard, but you have to double check, make sure you have the right concentration. Now, this is a nice trick because probably the first two drugs you would administer in a pediatric arrest would be epinephrine first, a pressor, and then if need be later, an antiarrhythmic amiodarone. Now, epinephrine dose, the first dose is 0.01 milligrams per kilogram. Now that's the same as 0.1 mLs per kilogram. So let's say your pediatric patient weighs 8 kilograms, right? So that 0.1 mLs per kilogram, you're going to draw up 0.8 mLs of 1 to 10,000 epinephrine, and that's your first dose of epinephrine. Now, the amount that you drew up, that 0.8 mLs, that's the same amount of fluid you would draw up out of the amiodarone to administer 5 milligrams per kilogram, which is the starting dose of amiodarone. So again, we're talking about the amount of fluid we're drawing up. In epinephrine, 0.1 mLs per kilogram. And on an 8 kilogram kid, that's 0.8 mLs. If it turns out that we're proceeding with our arrest and we have to go to an antiarrhythmic and we want to use amiodarone, we're going to draw up that same amount of fluid out of our 150 and 3 cc vial to administer 5 milligrams per kilogram. These tips really help to reduce stress and help improve patient care, but they must be used with caution, especially in medications. Make sure you're using the proper concentrations. I'm Mark, thanks for watching. See you in the next video.